adult, medical, and surgical patients. She is a wife, mother, and born again child of the Most High King.
Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers. We are here in Awesome Radio 107.5 FM and 1570 AM every Thursday from 3 to 3:30. So I invite you to join us every Thursday. We're here live in the studio. And this afternoon, I have a special friend with me. Special guest is Miss Deborah Herring, and she has a wealth of information that she's going to be sharing with us today. So, Deborah, welcome to Family Health Matters. I'm so glad you could be here. Deborah is a registered nurse. She has a bachelor's of science degree in nursing. She also holds a master's in healthcare administration, and she has a certificate in faith community nursing. Now she's retired from the public health nursing as retired from the public health nurse administrator back in 2016. But you know what? She's still working. She's still working wholeheartedly. She is a community health nurse with a passion. Her life's mission, she says, is improving the health of people in the community. And I have known Deborah for many years, and I have found that to be definitely true. You can find her serving somewhere, doing something to help the community. So, Deborah, thank you so much for being here with us.
And thank you for having me.
So we're going to jump right in, and we're going to be talking about hypertension. And I know people say, hypertension. I know about hypertension, but it's never, 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 never a topic that you cannot add to your tool belt with some information so that you can help understand hypertension better and to manage hypertension. And because this is Family Health Matters, we need to know what we can do to help our families who may have hypertension. So we want to make sure that we share this information. And we have a catchy topic. It goes hypertension, know it, control it. So if you know about it, then you can actually control it. So, all right, Deborah, we're going to tell me in your own words, tell me a little bit why you're so passionate about hypertension.
Well, I've always
Talk loud now.
yes.
I
Okay.
gotta hear
All
you.
right. I think that it's to me that I've been, as I have worked through the years, the community has given me the feedback that I need to work because I've had people that give me their testimonies and how we've made a difference in their lives. Most recently, I had a person just to let me know that I took her husband's mom's blood pressure. This was at Sam's grocery store,
Uh-huh.
and she said, "You don't know what difference it made when you start explaining to us." And this is outside of a doctor's office because public health went into the homes, and she said, "Then my mother's blood pressure, she was able to get it under control."
All
And so
right.
that those are the things that made me move forward to always make sure the patient was a partner in their care.
Okay, awesome. Yeah, because sometimes if you're in the doctor's office, they're moving so fast and
Yes,
you don't have that one-on-one. So
yes.
so that's when you take it to the street. So
Hmm.
that's a good testimony. That's a really good testimony. So as we start, let's do just some basic housekeeping as far as tell us about hypertension. Tell us about what it is, what those numbers mean, and then we'll talk a little bit more about managing it.
Okay. First thing, I think that people need to have a good understanding of why it's so important. That is that you understand what those numbers mean. And of course, you always hear blank number over blank.
Mm-hmm.
Okay, the top number is often, you may have overheard, but it's called the systolic blood pressure. But the main thing that you need to know is that is the blood pressure reading. The top number is when your heart is actually contracting or squeezing the blood to the vital organs in your body. So that is the systolic blood pressure, which will be the higher number of those two numbers.
Okay.
Then the bottom number is called the diastolic number, and that is going to be the lower because after it contracts and pushes blood out, then it relaxes between times. So that is the resting time where the arteries are now at rest. So that blood pressure reading should be lower. So
Okay.
that's why it's called your blood pressure readings, your systolic over the diastolic. So you need to understand why those numbers are important.
Okay. So now let me ask you this. Um, is there, what is the normal? What I know we hear, different things go back and forth. So
Yeah.
what now is out there in the community that says that what we can expect for a normal blood pressure
Okay.
reading would be?
All right. Well, we're looking at the American Heart Association,
Okay.
what their values are, and I'll walk through with you just the actual chart now to understand what the blood pressure categories are.
Okay.
And a normal blood pressure, when you in at any one, they have to have some set values. Normal is for the top number, and I'm not gonna say every time
Yeah.
systolic, diastolic, but the top number should be less than 120, and the bottom number should be less than 80 to be considered normal.
Okay.
Okay, if it's elevated, that number is considered elevated if the top number is greater than 120 to 129, and the bottom number has to be less than 80 for it just to be in the elevated category. So it still has to be less than 80 as if it's the normal. Okay.
Okay.
Then you move to, they have stages. Stage one in hypertension is considered stage one if your top number is 130 to 139, or either one of them could be out of line. The bottom number is 80 to 89. So example is you may have to be stage one, your top number could be 129, but your bottom number is 85. So that's still stage one.
Mm-hmm.
Does that make
Okay.
sense?
Yeah, that
Okay.
makes sense. Uh-huh.
Okay. Then there's stage two hypertension. That means it's becoming more intense. And the top number for stage two is 140 or higher, or 90 or higher.
Okay.
So either one of those numbers could be outside of the range, and it's considered as stage two. Now, the final one that you really want to look at is, we really don't want this one to happen because we want to know it and get it in control before then.
Right,
So
right.
that top number is greater than 180, and the bottom number is higher than 120. And that is considered a medical crisis. That means you need to get your doctor, see your doctor right away. If it is a possibility, you may have to go to emergency room because it is considered a crisis
Okay.
at that point. So
Okay.
that is what we look at when we're looking at the categories of blood pressure readings.
Okay. That's good. That's good because we need to know what the baseline is. Now, people that may have already been diagnosed with hypertension may, and this is just may see some readings that may be a little bit higher, but they know what their normal blood pressure is or what their normal range is. So their doctor is, this is right, their doctor can help them understand that maybe because they have a history of hypertension and their blood pressure has ran high for so long that it may not see 120 over 80, but it still may be controlled if they're on their medications. Is that right?
Absolutely.
Okay.
And the one big thing that we do push toward is that you take your medications accordingly, because the doctor has to make their decisions based on, am I compliant with my medications? Because you don't want them to keep raising medications when you have missed several days of medications, and then the doctor's thinking you're taking it. So you have to be real honest and take your medications as prescribed. And there's only other option is that as you have these lifestyle changes, then there's a possibility that your blood pressure could become back in the normal range, and then the doctor may make the decision to lower your medications all the way to, some people have been removed from medications.
Yeah, yeah.
Yes.
And that's a good point about being compliant
Yes.
to taking your medication,
Yes.
especially if you went to the doctor and the doctor has found that you do have hypertension, and it's important that you do what they ask you to do or what they tell you to do.
Yes.
Yeah,
absolutely.
and I think that was a good point that you made, that when you go in the office and say for some reason you haven't been taking your blood pressure medicine and your blood pressure is elevated at that particular time, you need to tell them that, because they
Absolutely.
may decide that, oh wow, she's running a high blood pressure, so we're going to raise her medication, increase her medication, which really is not a correct thing, because you didn't tell them that you hadn't been taking your blood pressure.
Exactly. Absolutely.
Yeah, and then you can get into more crises when you're not taking your blood pressure medicine.
Right. Or you wind up getting a prescription that's too strong for you and you start taking it and then that medication is over the amount that you need. So
Okay,
that's
yeah,
another
that's
issue.
good. Yeah, that's good because they don't know unless you
Right.
tell them.
Right.
And now tell us. We talked about understanding what the diastolic and the systolic is, and importance of taking your medications. So now tell us about. We talked about the categories.
Hmm.
So now talk about a little bit about how to, and people may think this is really minute, but it's important that you take your blood pressure the correct way,
Yes.
because you can alter that reading
Absolutely.
even in the doctor's office
Yes.
or even when you're taking it at home. So
Right.
let's talk a little bit. People may say, oh, that's really basic, but it's important and it's significant.
Absolutely. So the first, I have a list of tips that's really important that people make sure it's even when you're in the doctor's office, you try to make sure that this blood pressure, you're in that right position and doing all of these right tips there. Because I know a lot of you have heard about that white coat syndrome. You get a little anxious, and then that
Mm-hmm.
anxiety will elevate the blood pressure some. But the basic tips that we want to go through, first tip is before you take your blood pressure, and a lot of people now can get their and get their blood pressure cuffs, the automatic blood pressure cuffs from pharmacy or order them on Amazon or what have you, and try to get a good brand that your doctor may recommend, one that they think you should have, and 30 minutes prior to taking your blood pressure, make sure if you are a smoker, no smoking. That's a minimum. You'd like for it to be longer, but at least
Uh-huh.
30 minutes. No exercise, no caffeine, don't, and you got to think about it's not just coffee with caffeine. Some of these drinks that you go into, even the considered healthier places, may have some caffeine in it, like at Starbucks or what have you. And then no alcohol because that can raise. And also, the next thing is you want to make sure before you get ready to take your blood pressure that your bladder is empty, because that's another stressor. If you send signal to your brain, and then that can send stress and your blood pressure raises. So make sure your bladder is empty.
Right.
Okay.
Okay.
And the other thing we want you to know is in making sure that your optimal blood pressure is measured is 3 to 5 minutes prior to taking your blood pressure. You want to make sure that you sit and relax. Don't talk, just have some downtime before you start taking your blood pressure. Don't run around the house sweeping and then all of a sudden you're going to do your blood pressure. So, and then the next thing you like to do is make sure you have the right size cup
Mm-hmm.
for measuring your blood pressure based on your size, your arm, and make sure that it fits you and it wraps around, and that you're able to get it above. Put the position of it has to be above the elbow. Usually they say you can take a couple of fingers and put there that your blood not right in the middle of where your elbow is, but right above there, and that's really important. Uh, so you want to wrap that cuff around, and then again, it's best if it's against the skin versus having it on clothing. But if you have it on, if you do actually in a place, because a lot of times you go out to the pharmacy, drugstore, because you may not have a blood pressure cuff, and that's an okay place
Mm-hmm.
to take it, but just try to, they have the little seats and booths for you to sit in. Sit there, but if you can't come out of that clothes, it's better if you just keep the thinnest piece of cloth on, and then keep it down straight, because if you pull it up high, it could actually make a more of a band around you, and actually intensify your blood pressure. So it's better
Okay.
just to keep your clothes, that little thin shirt or what have you, down. But
Okay.
the optimum would be just on the skin.
Right.
Okay.
Okay.
So
On the
just wanted to
skin.
talk that about the clothing.
Okay. Good.
Okay. And the other big thing too is um, to make sure your arm is rested comfortably on a table that's at heart level, just so you can relax that arm out, and and that's the best place for you to have, to get your blood pressure taken. And wanted to, when you sit, make sure you sit upright, have your feet flat on the floor. Do not cross your
I
legs. That
know.
is because people, it's a natural thing that you automatically um,
Somebody wants to ask the question.
yes, evidently, that you that you automatically think you cross your legs, and but make sure those feet are flat on the floor, and then you just do that relaxing and take the deep breaths and don't talk. And once you get in that position, you press the start button and let the blood pressure, as it begin to take. And then you have completed, once the reading is there, then you refer to those categories that we talked about and to make sure that your blood pressure is, in the range that you normally have, or either you need to consult with your doctor, follow those guidelines is what we really want you to do. So the other thing I would say to you is that based on if you have some people have actual wrist cuffs. And so that particular type cuff, the position you should have that on is actually you bend your elbow and relax your arm up at your chest wall, like right at the heart level, so that once you hit that start button, that your blood pressure reading is recorded normally. So that helps with the optimum blood pressure with the wrist cuff.
Okay, so they should be actually across your chest.
Right. Your arm
Okay,
should
with
be
that the wrist with the wrist one. Okay,
Right.
good, good.
Yes.
How do you determine the best fit for a blood pressure cuff? I mean, if it's too tight, or
Yeah. Well,
is there any recommendations just to?
the big thing is because they have different size cuff. They have a regular standard size. It's based on how many inches the diameter of your arm. But you need to be able to. It has a little Velcro stick. That Velcro stick, if it's barely getting over there, it's not going to stay on there. When you pump it up, if you notice that blood pressure cuffs go toot and it pops off, that cuff is too small and it's not going to give you an accurate reading. So that Velcro must totally be able to clasp and lock down and get tight on there.
Okay.
Okay.
Well, okay, Deborah, I got a question for you. Somebody, this person is following us on Facebook.
Okay.
Yay, thank
Okay.
you. But they asked, what are your thoughts about a blood pressure watch? Do you feel that they are pretty accurate?
Well, technology has improved so much now until I think it's really good to have confidence is I would like measure it with the watch reading and then one that you have a regular cuff. And if it stays pretty normal, I would feel comfortable with that. And, just share, like I said, if you carry that report to your doctor, let them know that this is what you used.
Absolutely. That's a good point. So I hope that answers that question. And that's good because you mentioned a little bit about keeping a log,
Yes.
about making sure that you keep a log so that when you actually do take these blood pressures and your readings, that you can take them to your doctor so they can have that to compare.
Yes.
And help, that will also help them regulate the
Yes.
medications that they may be prescribing
Right.
for you.
Because they totally understand about that white coat syndrome. And a lot of times, like I would tell people, when you get, the office can be so busy until the person is trying to get you checked in or start asking you questions. And so you need to, I always tell them, I close my eyes and start taking deep breaths. And so therefore they know I'm not going to talk with them while my blood pressure is being taken. So relax, even in your doctor's office.
Right, absolutely. Relax while you're in your doctor's, and I think that is a good point. And be okay about saying, well, let me calm down.
Yes.
Before, because you do have people that sometimes time you sit down in the chair, the first thing they want to do is take your blood pressure. And what I've started to do is let them ask me my questions first, then take my vital signs or my blood pressure at the end. And that has given me an opportunity to sort of,
Yes.
rest a little, especially if I had to walk away from the parking lot or
Yes,
somewhere.
absolutely.
Yeah. Before we move from that, let me ask you one more question,
Yes.
Deborah. Suppose I get a high reading on my blood pressure. Now, how long should I wait before I take it again?
Okay. Typically, you need to relax and not just take it right back to back.
Okay.
At minimum, it's good if you could wait 5 to 10 minutes and just relax and stay still there a little bit. And then, because if it's real high, it's better for you not to just ignore it and, start doing something else and forget about it. So it's better, I'd rather see you take it again in 5 to 10 minutes.
Right. Okay. And that's good because that gives you a chance that if it is for real, that you'll know that it wasn't because you were moving around, and
Right.
then you take it and you go start doing something and you won't expect any changes.
Right.
And
Exactly.
I think too, just to emphasize what you have said, is that if you get a blood pressure reading that's incredibly high, too many times, you need to be going to the emergency room.
Absolutely.
And, we're not talking about complications today about
No.
hypertension, but you can, have some increased risk of stroke or other medical
Absolutely.
problems. So,
Absolutely.
but I wanted to make sure that we understood the basics of how you actually take that blood pressure correctly.
Absolutely.
Good.
And for some people, they do, it's called sometimes that silent killer. They don't even realize they're used to these symptoms. They don't realize that their blood pressure is that high. There are other people who do have symptoms, begin to have the headaches and, those type things. Or uh, so you want to make sure that you um, get those readings so you can make your decision.
Yeah, yeah. And that's part of what we say, know your numbers.
Yes.
We often talk about knowing your numbers, not only just your blood pressure, your finger stick blood sugar,
Yes.
but also your blood pressure, because it can be a silent killer.
Yes.
And you can feel fine and be walking around with an elevated blood pressure.
Yes.
Okay, great. That was good. And I love the way you just simplified and explained that to us. Now, let's talk about what we call the essential eights.
Yes.
Okay, let's do
Okay.
that. We don't want to run
Okay.
out of time.
Okay,
So,
yes,
yeah,
yes.
we're doing good. We're
Yes.
doing good.
So the big thing about essential eights, and that's American Heart Association document based on research, but it's never too late to make healthy choices is the major thing about that. So how do you achieve these? And they go over 8 things that supports your cardiovascular health. And in that, number one, of course, eat healthy, have a diet that's consistent with the American Heart Association. And if you all know, we Google everything now.
Yeah.
Google my plate, and that will go over you how much food should be with your protein, how much with your sugar, your vegetables, and over half of your plate should be, fruits, should be vegetables.
That's right.
Yes, so that's great. Then exercise is your next thing. They should have at least 150 minutes of moderate intense exercise on a weekly basis. Or you could have, if you're a little bit younger, and there are young people who have high blood pressure, 75 minutes of vigorous intense exercise, or a combination of those throughout the week. The next big thing is don't smoke, and try to avoid secondhand smoke. People don't understand that secondhand smoke does impact. Yes. And rest and relaxation, try to average 7 to 9 hours of sleep per night or day, whatever your shift work would
Yeah.
be. Yeah, I can't take it all there. So it's really important that we understand that our health is not only our physical health, but our stress and mental health is important. So maintain that healthy body weight, which is, you've ever heard people talk about your BMI, that's your weight versus how tall you are. So we all have different weight based on that, our height and weight combination. So if you will make sure you aim for those goals. It's not an overnight thing, but you can aim to get closer and closer to what's normal. Get your cholesterol checked by your healthcare professional, and they will do that. And and based on your family history, all those things, they may do it more often than not. The other thing that's really important is your understand your blood sugar levels. Fasting blood sugar level, meaning you haven't had anything to eat within that time frame should be less than 100. And then you should have an A1C, which is your average blood pressure readings, should be less than, it's 5.7% for A1C.
That's your sugar, right?
That's your blood sugar.
Blood sugar. Okay.
Yes,
Okay. Blood
absolutely.
sugar. Okay.
And doctors may do that. Some people can, if you have a family history or what have you, you may just decide you can actually buy those monitors in a pharmacy or drugstore to check your blood sugar if you have concerns or they're monitoring you. And the 8th one is what our main topic was today, is to keep your blood pressure below 120 over 80. So that's this one of the final of our essential 8.
That's right.
For
Good.
reputation.
Good. That's essential 8 sort of leads, sort of like summarizes how you can make sure that you're on track as far as keeping your blood pressure within the normal range. And I think I go back to what we said initially, Deborah, about if for some reason you do have blood pressure, and people think that you have to be obese to have hypertension.
Absolutely
that doesn't have, I won't say it doesn't have anything to do because you just talked about maintaining a
Yes.
healthy weight,
Yes.
but that does not make you any more likely, or it doesn't cause you not, because you see people that are small who
Right.
has
Absolutely.
hypertension. So you have to make sure that you're talking
Yeah.
to your family, your healthcare provider.
Right. And you have some people, some things are based on things that's out of your control. Like for instance, the family history, your age, your gender, whether or not there's kidney disease.
Well, Deborah, I'm gonna cut you
Okay.
off
Okay.
because
All
we
right.
are almost out of
Okay.
time, and
Yes.
I'm so glad that
Yes.
we are here on Awesome Radio with Family Health Matters. We're here every Thursday. Deborah, we just gonna have to bring you back because I wanted you to get in your saying, but we are here every Thursday from 3 to 3:30 on Family Health Matters
Yes.
with WECU 107.5 FM and 1570 AM. And again, I'm your host, Wendy Bridges. Thank you so much, Deborah, for being here and the wisdom and knowledge that you have shared. We're going to manage our blood pressure better, and we're going to be better for it.
Yes.
Again, thank you for joining us here on Family Health Matters, and hopefully we'll see or hear from you back on next Thursday from 3 to 3:30 on Awesome Radio. Have a good afternoon. Thank you,
Hello
Facebook
to
fam.
our awesome radio friends and partners. This is Akila speaking here. You can reach us at 252-756-3137. We thank you so much for listening to our awesome radio network of stations. WBISLP Espanol 106.